Today we will be talking about estrogen's role in preventing type 2 diabetes mellitus. We'll start off with some background information. So, estrogen is the primary female sex hormone. It functions in the development and regulation of the female reproductive system and secondary sex characteristics. It is produced in the ovaries. The main estrogen is estradiol, and the injections that will be used in the paper that we will see are 17-beta estradiol. Obesity is having excess body fat. More than 1/3 of American adults are obese, so it is a very common problem, thus a lot of research is being directed at this. Obesity is related directly to some of the leading causes of death, which include type 2 diabetes mellitus, which we will talk about next, heart disease, and some cancers. Type 2 diabetes mellitus is a chronic metabolic disease that has to do with insulin production. A patient would have previously had normal insulin production, but now something has happened, usually stress to the body, that has caused the insulin production to either decrease or to become resistant, meaning the insulin does not do its job anymore of decreasing the blood glucose levels. Thus, this is different than type 1 diabetes mellitus, which those patients never have correct insulin production. Type 2 diabetes mellitus is very common. There's 382 million people affected worldwide, which means the pandemic, and that there's a lot of research covering diabetes mellitus type 2. The symptoms include retinal damage, early heart attacks, peripheral nerve problems, kidney degeneration, and peripheral tissue damage. In the paper we will be looking at today, in mice, it is defined as being greater than 16.6 millimoles per liter of glucose in the blood. What we'll be focusing on is titled Diabetes Prevalence in New Zealand Obese Females Depends on Estrogen Action on Liver Fat Content by Labura et al., published in the American Journal of Physiology on October 20th, 2015. The researchers in the study wanted to compare the fat distribution between diabetic and non-diabetic mice in order to use the distribution as a factor that could lead to an early prediction of type 2 diabetes mellitus. They also wished to know more about the effect of estrogen on the development of type 2 diabetes mellitus. The outline of the experiment is two experiments, with A outlining the fat distribution experiment and B outlining the effect of estrogen experiment. Here we have the figure that explains the experimental outline of the comparison of the high-fat diets to the standard diets of the New Zealand obese mice. Week 0 is their birth. Then they stay with their mothers until they were weaned at week 3, at which time they were put into individual cages. Then at week 5 they were separated into the control group of the standard diet that had 9 subjects, and then the experimental group of the high-fat diet, which contained 60% fat and had 42 subjects. At weeks 10, 16, and 22, the researchers assessed the body fat distribution through the total fat and the visceral fat, and also assessed the liver fat content by computed tomography. Computed tomography is an imaging technique that uses X-ray to create detailed scans of the inside of the body. The computed tomography found that there were no differences in the total fat or the visceral fat, but the liver fat content was different. In the graph on the left, each of the 3 time points are along the x-axis, and the percentage of liver fat is on the y-axis. The dark bars are the diabetic mice, and the white bars are the non-diabetic mice. Each of the time points show that the difference is significant, with 3 stars indicating a p-value of less than 0.001 and 1 star indicating a p-value of less than 0.05. This means that each of the time points were statistically different with respect to their liver fat content. On the right is the liver fat percentage from week 10 on the x-axis, and the blood glucose level in the concentration of millimoles per liter from week 22. The p-value of 0.0002 shows that there is a linear regression that is significant, meaning that the liver fat content can accurately predict the blood glucose levels. This means that the liver fat percentage could predict the likelihood of the onset of type 2 diabetes mellitus. These conclusions are that 43% of high-fat diet subjects became diabetic, whereas none of the standard diet subjects were diabetic. When the liver fat content was greater than 9% in week 10, the onset of type 2 diabetes mellitus was predicted with 70% accuracy. The glucose content of greater than 10 millimoles per liter at week 9 predicted type 2 diabetes mellitus with 63% accuracy. The combination of these two indicators predicted type 2 diabetes mellitus with 79% accuracy. The experimental design to find out the effects of estrogen started with the birth at week 0, then the weaning from the mothers at week 3, and then the high-fat diets given to them starting at week 5. The first computed tomography was done at week 10. Then the animals were separated into 2 groups, the diabetes-prone control group, then the diabetes-prone E2 group. The E2 group received the injections of estriol. Then at weeks 13 and 18, the oral glucose tolerance test was done, and then again at week 20, the computed tomography was taken. Estrogen results on diabetes prevalence and liver fat content are shown here in the form of graphs. On the left, the x-axis is time in weeks, and the y-axis is the percentage of the population that has diabetes. The two populations are the diabetes-prone control group with the black circles and the diabetes-prone with estriol group with the white circles. The control group all got diabetes, whereas less than half the estrogen group got diabetes. On the right shows the liver fat content on the y-axis, with the treatment groups on the x-axis, and the time point of week 10 with the white box, and the time week of week 20 with the black box. The only significant difference is between the treatment groups at week 20, which shows how the estrogen prevented the increase in liver fat content, whereas the control group that did not have the estrogen injections had an increase in liver fat content. The conclusions we can make from the estrogen experiment is that estrogen reduced the prevalence of diabetes from 100 to 42% and also prevented the accumulation of fat in the liver. An oral glucose tolerance test is a technique that measures the ability of the body to use glucose by assessing the blood glucose and insulin levels. Estrogen decreased the blood glucose and increased the insulin levels. The combination of these indicate that the estrogen enhanced the glucose tolerance. Also, the estrogen was found to decrease the amount of MOGOT1 and CD36 transcripts. Some important things to take away from this presentation are that the combination of liver fat content and blood glucose levels can predict the onset of type 2 diabetes mellitus. Estrogen can prevent liver fat accumulation and type 2 diabetes mellitus. The transcripts of MOGOT1 and CD36 are abundant in diabetes-prone animals before the onset of type 2 diabetes mellitus.